know a lot of you have a lot of questions, so joining us now in studio to answer all of those coronavirus questions, we have Dr. Rupi and her husband, Dr. Neil. Thank you guys for being with us.
Of course.
Before we get to our viewer questions, let's go over some of the basics. What can people do to prevent catching the virus?
Yeah, so I think one of the key components there is good hygiene measures. I know we've talked about that a lot, but kind of frequent hand washing, using kind of water, soap, or alcohol sanitizer is going to be a very important part. Avoiding touching your face, that's one of the World Health Organization kind of comments to avoid spread. And then if you are feeling unwell, if you've got a cough, wearing a face mask, isolating yourself, and if you're coughing into your elbow, or kind of using a tissue, but making sure you discard it appropriately.
Dr. Rupi, let's go over proper hand hygiene.
Yes,
I know our viewers probably say that we always, the media's mentioning it a lot.
Yes.
But you said that a lot of people are doing it wrong.
Yes. So we sound like a broken record. We're constantly talking about wash your hands, wash your hands. 20 seconds, we get it. Sing happy birthday twice. However, washing the hands correctly is also very important. So there's 7 steps. So we're just going to go through the 7 steps really quickly. So water, soap, sudsing up. You want to get the palms of your hands. You want to get the backs of your hands. You also want to get in between your fingers. You want to get the crooks of your thumb, both sides. You want to get your wrists, both sides, and you also want to scrub your nails. So when I watch people, I don't see folks doing this often. So it's just really important to know that those are the 7 steps. 20 seconds of that. You can sing Happy Birthday twice. If you don't love that song, you can sing Lizzo's Truth Hurts as an alternative, just the chorus, and that's about 20 seconds as well.
And I'm guessing most people don't do it that extensively.
Unfortunately not. I sometimes do see folks, but just as a reminder that basic hand hygiene, that's actually what it entails, to get rid of those germs.
And again, no coronavirus cases here in the state, but it's good to start getting in the habit of proper hand hygiene. Who is most at risk for coronavirus?
So those at most risk are the elderly, in terms of kind of the serious health conditions sequelae that can happen, as well as those with chronic health diseases and those with weakened immune systems.
What can people do if they think they have the virus? When is it the right time to go in and see somebody?
So this is going to be based on what their symptomology is. Now, there's a lot of overlap between the coronavirus or the COVID-19 symptoms and flu. So it's sometimes hard to differentiate. And so this is going to take seeing a physician, talking to them about symptoms, but also getting tested if they think that you are at high risk.
Okay. Now, Dr. Neil is also the founder of We Prescribe. Tell us about that, since we're on the topic of when people should go in and see a doctor.
Yeah, so We Prescribe is a telemedicine company founded here in Hawaii. I'm one of the founders, and we deal with health conditions remotely. So people in the convenience of their own home and using a phone can have consultations for simple health conditions. And I think right now, trying to avoid exposure, avoiding unnecessary consultations, going into clinics and so on, this is just an important time to know about that.
So for anything, if people have concerns and they don't want to leave their homes, they can talk to a doctor from their couch, let's say.
Yeah.
Okay, very cool.
WHO is actually recommending for tele-everything right now, especially in high-risk situations. So teleconferencing for offices, if you don't have to go in for meetings, doing a teleconference. So telehealth is along that same avenue.
Okay, let's get to some of these viewer questions that were posted on our Facebook page as well as the KHON2 Instagram page. Should we worry about flying anywhere?
So I think the consensus is avoid non-essential travel to the high-risk countries where we know there's kind of high incidence.
Okay.
And in terms of the the most up-to-date areas, that's going to be the CDC and WHO websites.
Good information there. If you catch the virus, how long does it last?
So that really depends on the severity of illness. Now, it ranges from very mild symptoms. In fact, we think some folks end up being asymptomatic entirely, and it can go all the way to very severe symptoms, landing in the hospital with pneumonia. Now, thankfully, it seems at this point, and the situation continues to evolve, I have to make sure to add that in because things are ever changing, but it seems that about 80% seem to be on the milder side. Now, however, 20% are more severe, ending up in the hospital, requiring more care. So it really just depends on how severe of the illness it is.
All right. Someone also wants to know, is it possible to still get coronavirus and not travel to China?
So at this point, it does appear to be so, and we are seeing transmission outside of China and transmission in countries without having that travel exposure. Again, the situation is evolving. Things have changed rapidly. It's really important to take advice and take a look at what the CDC is saying, what the Department of Health is saying. Those are going to be your most valuable resources.
Another viewer question, you touched on this just a little bit ago, but how can we tell between the coronavirus and the flu?
So there's a lot of overlap when it comes to symptoms, so cough, fever, shortness of breath, and really to differentiate between them, it's going to be through testing. So via your PCP, having the adequate kind of testing to differentiate between them.
One thing I will mention here is if you are concerned that you have contracted the coronavirus, the first step, most important, would be to protect others, so putting a mask on yourself and also making a phone call to your primary care physician to give them a heads up that you're going to be coming in to be evaluated for coronavirus so they can take the appropriate measures as well.
Giving a heads up, that makes sense. Will the coronavirus end when the weather starts to warm in April?
That's a tough answer because we don't know enough about the coronavirus at this point. What we can do is make an educated guess. Now, other viruses like the flu don't entirely go away during the summer months. They do continue through the summer, just at a lower rate. The likelihood of this going away is probably unlikely, just seeing what's happening right now. We are likely to be impacted in the islands, and I don't know that weather is going to affect that. It's very unclear at this point.
Dr. Rupy, Dr. Neal, thank you so much for being here, and thank you for submitting all of those important questions, and thank you guys for answering them.
Thank you.
Thank you.
Howard, send it back to you.